Welcome to Brilliant OET. Vinod Kumar, a OET trainer. Now we'll have another session on OET writing. Now we'll have writing to occupational therapist. Before going to the session, I would like to tell you what is the work of occupational therapist. So if we understand the medical professional's work, it will be better for us to select appropriate case notes for your writing. So occupational therapist will help patients who are not able to function fully, and with the limitations they will help them what they can do with the limitations, or they will help them to lead a normal life with the limitations. Say for example, if a patient is not able to get up or is bedridden, or else if he is on wheelchair, he will not be able to get up, or medically he is advised not to get up or bend forward. In that case, how can he improve his normal life? And he will assess what is his daily living activities, how he can perform all those daily living activities with the limitations that has been there for the patients. So now we will go to the stimulus. Stimulus, whenever you get a stimulus, the first and foremost thing that you have to do is go to the task, because only when you understand the task, you will be able to select appropriate case notes for your writing. So what is the task? We will take second task, that is occupational therapist. Complete a home hazard assessment since she will be living alone. Discussed with patient, non-slip mat for bathroom, rails, worried needs help from daughter for cost. Sock and shoe horn, reacher, dressing stick and raised toilet purchased by daughter. Needs to be shown how to cook meals, that is using reacher, no bending, etc. Placement of food items important. Can resume mild exercise after 12 weeks subject to physio review of progress. Yearly x-rays. In your answers, expand on the relevant case notes into complete sentences. Do not use note form, use correct letter format. Next, medication is the same. You don't need medications for occupational therapist. It's very simple to understand. Occupational therapist will not administer any medication. In the beginning of the session, I have explained what is occupational therapist work is. He will help you to function with your limitations. He will not administer medication, he will not do dressings, he will not do any nursing or medical works for your patients. And next one is, all those informations are irrelevant and some informations are relevant in this, which you have to select. Decreased medications that they have not mentioned, decreased mobility, compression stockings for blood flow is not required. Precourse increased to 50 mg post-operatively, it's a medicine, it's also not required. Able to walk to the bathroom with a walker, yes, this is required. Why it is required is, it explains the limitation. She is able to walk, her mobility. Then compression stockings removed, it's not required. Readings at discharge, pain described as 5/10, increases after walking for 5 minutes. This is important. Both case notes are important because this explains her limitations. How far she can walk. She can walk only for 5 minutes, not more than that. And moderate mobility, walk approximately 50 to 60 steps. This is also important. Incision site, slow healing, it's not required. Daily dressing, not required. Staples, not required. Monitor blood sugar, it's not a work of occupational therapist, so it is not required. Next is, now we'll see the case notes that need to be included for occupational therapist and the case notes that needs to be omitted. Post-operative management. Post-operative management in the sense how she was, blood transfusions, IV fluids, antibiotics, all those information you can avoid. Next one is nursing management. Nursing management in the sense how she was taken care, activities of daily living, bed bath or any other nursing care that is given in the hospital, you can omit. Third one is treatment and medication. Treatment, as I said earlier, same like medications, antibiotics, any IV fluids, all those you can avoid for occupational therapist. And next one is important case notes Important case notes that must be included for occupational therapist. Post-operative mobility, how far she can walk, whether after the surgery whether she is able to walk or not. Is she still bedridden? What kind of work she can do? What are the work she cannot do with her limitations? Or is there any specific medical advices for not to walk? So all this information you will have to add in this post-operative mobility. Patient's ability to perform ADLS. In our case notes, Miss Cindy Shah is 75 years old and she is not able to walk. She is on wheelchair. With her limitations, what are the activities of daily living she can perform and how she can perform, and what are the assessment that he has to do, and what are the teachings that he will have to give her to help her function better with her limitations. Third one is pain level associated with mobility and use of mobility devices. Third one is pain level associated with mobility. As we have selected case notes, how long she can walk or how far she can walk. 50 to 60 steps she can walk, as we have selected here. After that she gets little pain, and 5 minutes, most of the time 5 minutes she can do mobility, like she can walk for 5 minutes. After that she will have pain. That's what this pain level associated with mobility explains us according to the stimulus. Next one is use of mobility devices. At the end, in the beginning we have gone to the task. In that task there are some devices, reacher and wheelchairs, toilet riser. So all those devices, it's not easy to learn by reading user manual. So this occupational therapist will help the patient to learn about those equipments, how to use it maximum. So that's what occupational therapist work is. So if you concentrate on these information, it will be better and you will score whatever the score that is required for you. Next, this is the format that you will have to use for OET writing. First, address. Address, we don't have much information about address. So we just write it, the occupational therapist, and the date of your letter writing. In the letter, the discharge date was 28, so I have added that information. Most of the time, you will have to write your examination date, because your examination date is going to be your letter date. So you will not have any doubt on exam date. And here 28 September 2008 is our letter date. Next, we don't know the occupational therapist, whether he is male or female. So just write dear sir or madam according to the format. And reference, Miss Cindy Shaw, age 75-year-old. Now introduction. Introduction, you can have different types of introduction, and here it's a model letter and it explains, and I'll just tell you what are the information that you have to add in your information. 3 information that must be there and plus another information. First one is name of the patient, second one is the problem of the patient, third one is purpose of writing it. If you don't have 3 of this information, then consider your introduction is incomplete. And always remember to have it included in your introductions. And with that you can also include status. Status in the sense, not the economical status, when will the patient get discharged, because only when you inform the occupational therapist the discharge of the patient, he can go to the patient's home and he will give his help. So have all those 3 information necessarily plus the discharge information. Patient is going to be discharged today, that type of information. And I'll just read out the introduction. I'm writing to inform you regarding the assistance and home modifications required for Miss Shah, who is going to live alone after left hip replacement surgery. Now, first paragraph after introduction. Miss Shaw was admitted to hospital on 23/9/2019 for surgery. Post-operatively, see, post-operative mobility. Post-operatively, she recovered well and attained moderate mobility. So we have included post-operative mobility of patient. She is able to walk approximately 50 to 60 steps with the help of walker. However, her pain level increases from moderate to severe after ambulating for 5 minutes. So we have included her ability to walk, how long she can walk with the help of walker, and What is her limitation? After walking for 50 to 60 steps, she gets pain. So this explains her limitation plus her pain levels. So we'll go to the next paragraph. Okay. Now, third paragraph, what you have to do is social informations. Social informations. It's not like she lives with her daughter and she's going overseas. Simply writing it and making over a third paragraph. You will have to connect between what is the social information and what is the relation between the occupational therapist. Why do you include that social information to occupational therapist? Now I'll explain with the paragraph. Although Miss Shah lives with her daughter, she will move into self-contained flat by next week as her daughter lives overseas. Actually, this Miss Shah is living with her daughter. Since her daughter lives overseas, she will move to self-contained flat. Note this point, you will have to include this self-contained flat because she is going to be all alone. And occupational therapist help is very much needed to help her how she can perform her daily living activities with her limitations. Now, I hope you understand why do we need to include social informations for occupational therapist. Therefore, it is highly significant to perform a complete home hazard assessment. Home hazard assessment in the sense whether there is any kind of risk associated with fall, risk associated with any kind of other injuries, home hazards. So all this assessment has to be done and he has to modify and arrange things for her. That is the requirement here we are requesting. As well as this, it is important to check whether the stairs of the flat are walker friendly or not. So you will have to include this information, and it is self-explanatory why we have to add this information. Next paragraph is, please note Ms. Shah's daughter has already purchased the assistive devices such as sock, shoe horn, reacher, dressing stick and raised toilet seat. Kindly train her. So tell them what and all things that is available and what is his responsibility when he goes to the patient's home for his teachings. So what he has to do is kindly train her to use the equipments. Full stop. Could you please demonstrate the technique of using devices like reacher while cooking and help her arrange the food items appropriately? Like how to use the reacher. I haven't informed or added the information how to use the reacher here. And there is a limitation that she must not bend forward when she is on wheelchair because she has undergone left hip replacement surgery. Hip replacement in the sense the patient is on wheelchair. She cannot walk or she cannot move from her wheelchair. So on the wheelchair, how she can use the reacher to take just to reach other items and take other items. Like things that is needed for cooking or washing or anything that is required or as she wants to perform her daily living activities. Next one is, please note, okay, that is over. Last one is, Ms. Shah is already aware of the need of non-slip mat and rails for bathroom that require financial assistance from her daughter. It's a simple information. She is already aware that she requires financial assistance from her daughter, and this is non-slip mat is again home hazard. If something slippery mat and all if we buy, she's already on wheelchair. She cannot walk. If she slips, that's going to worsen her condition. So it's better to inform all this information. And at the end, its conclusion, you can have your conclusion specific to your introductions. And I have just added a simple conclusion. And I hope this helps in writing a letter to occupational therapist. Thank you.